My name is John Matoizo, and this is my informative speech on strokes. Every 40 seconds, somebody in the United States has a stroke. According to the CDC.gov, reviewed January 31st, 2020, somebody will die of a stroke every 4 minutes. Strokes occur to our loved ones, and it's important to know what is happening and what you can do to help. Unfortunately, as an EMT, I have answered the call for a stroke, doing what I could to help with the limited resources I have. Throughout this speech, you will learn what a stroke is, the signs of a stroke, and what to do when you witness one. This will help further your understanding of strokes and how to react in the best way possible for the best possible outcome. A stroke is when something blocks blood flow to the brain or when a blood vessel bursts. 87% of strokes are found to be ischemic strokes. An ischemic stroke happens when blood flow through the artery becomes blocked. There are two other types of strokes that can occur. A hemorrhagic stroke happens when the artery either leaks or ruptures. A transient ischemic attack, also known as a mini stroke, occurs the same way an ischemic stroke does. However, this is normally a shorter time frame and usually happens only within 5 minutes. There are 3 main signs to look for when someone is having a stroke. As stated by stroke.org, reviewed October 2nd, 2018, the 3 signs to look for are facial drooping, arm weakness, and slurred speech. Facial drooping occurs when one side of the face droops down lower than the other. This can usually be tested by asking the person to smile to see if one side of the face doesn't lift up like the other. This is usually accompanied by slurred speech, which can be tested by having the patient repeat a sentence back to you. For example, having them say, "The sky is blue over Boston." Also, a person can be having arm weakness. This can be tested by having the person put both their arms out in front of you and seeing if one drifts down lower than the other. There are additional signs you can look for when you suspect somebody is having a stroke. An additional sign of the stroke is trouble walking, which can usually be seen by the lack of coordination by somebody. Another sign of a stroke is trouble seeing, which can occur with either one or both eyes of that person. When someone is having a stroke, it is vital to get the person help right away. According to Medical News Today, reviewed August 19th, 2017, the first thing you should do when suspecting someone is having a stroke is call 911. Make sure the area is safe and the person is not in imminent danger. Talk to them by asking them questions, which can also help gauge what symptoms they are having. As stated in pennmedicine.org, written April 29th, 2019, note the time you first started seeing symptoms. This is known as their last known well time. Telling first responders when their symptoms first started is critical as it can determine their cause of treatment. A clot-busting medication called TPA is used for strokes. However, it is time sensitive and can only be used within 4.5 hours of the last known well time. In conclusion, strokes are a serious medical condition and need to be recognized and treated quickly for the best possible outcome. We have looked at what a stroke is, the signs of a stroke, and what to do when you suspect someone is having one. It's important to remember what we have gone over as it can help save somebody's life. A stroke is a block in the blood supply to the brain and can be extremely dangerous. Remember that the main signs are facial drooping, arm weakness, and slurred speech, and these are the first things you should look for. It's important to call 911 immediately to have the best possible outcome. Remember, every 4 minutes somebody dies of a stroke, but early recognition and medical treatment can be the difference between life and death. Thank you.